Hello. Welcome to another YouTube Live, a lunchtime live. I'm Dr. Frida. This is my practice manager, Ms. Shador, and we are here to do another live. You comment, make sure you ask question answers right here, real time. Hi, Henry. Hi, Mr. Martin. Thank you for being the first to join us in this lunchtime live, and we will go ahead and get started. And this not only is live on YouTube, it's also live on Instagram. So please join me, follow me on Instagram, and you can watch this there as well. Lupus, systemic lupus erythematosus. It's a very, very common autoimmune disorder, meaning that instead of the body's immune system attacking bacteria, viruses, germs of the outside world, in lupus, the body actually turns against itself and attacks itself. So systemic means multiple organs. So lupus affects many organ systems in the body. Lupus actually means wolf. And some people believe that some of the lesions were thought to look like wolf bites, and that could be why they use the word lupus, but it does actually mean wolf. And then erythematosus, erythema means red. So you get red lesions, multiple organ systems. Lupus can affect the hair. You can get alopecia or balding from lupus. You can get pericarditis or inflammation around the heart. You can get kidney disease. You can get other forms of heart disease, lung disease, arthritis. Pretty much any system in the body can be affected by lupus, so it's quite serious. It's more common in women than in men. In fact, it's 9 times more common in women than in men. It's common in women in reproductive age, like technical reproductive age between 15 and 44. And African Americans and Hispanics are more affected than non-African Americans. And we're not exactly sure why people get lupus. We believe there's a genetic component as well as environmental, hormonal. We believe that estrogen plays a part, which is why it's mainly women in reproductive age who get the lupus signs and the symptoms. And now we'll just get right into it. Please go ahead and ask us questions, and we'll go ahead and answer them for this lunchtime live.
All right. I also want to say hello to Suhani.
Hi, Suhani.
Today. Question, is lupus hereditary?
Yes, we do believe there's a genetic component, but it's even bigger than just being hereditary. 2 people with the same genes can be maybe predisposed to having lupus, but depending on the environment or the hormones, one may get it, one may not. But there's definitely a genetic or hereditary component.
Okay. Question from Mia.
Hi, Mia.
What blood tests are used to find out if you have lupus?
Very good. So there is a screening blood test called the ANA, or the anti-nuclear antibody. This test is sensitive, as in if you have lupus, then very likely your ANA will be positive, but it's not a specific test. So you could have a positive ANA and not have lupus. Some more specific testing includes an anti-Smith antibody, as well as an anti-double-stranded antibody. And there's some other ones as well, like antihistone. But the screening test, the screening blood test for lupus is an ANA. And so you consult your physician, ask if that's something you should get done. And if the ANA is positive, your primary care physician can take it from there, or even refer you to a rheumatologist, which is a specialist who deals with lupus.
I noticed that when we have new patients come into the office, you always order an ANA.
Mm-hmm.
Is that one of the tests you order just to rule out lupus not affecting the reason for them having kidney disease?
That's a good question. That's true. So for all of my patients here at my Emory Midtown office, where I practice nephrology, the study of kidney disease, when I have a patient with kidney disease, I do an ANA. And that is to screen them for lupus, because lupus is a major cause of kidney disease, lupus nephritis, and lupus-induced kidney disease. If that ANA is negative, then the chances are great that that patient does not have lupus, although you can get false negatives, meaning you can get a test that's negative for lupus and a patient really has it. But there are ways to figure that out. But if the test is negative, then the chances that they don't have lupus are great. But it's a way for me to see if I need to investigate lupus as a cause for their kidney disease.
Okay. From Rosa Luz.
Hi, Ms. Rosa Luz.
I was told by my doctor that I have borderline lupus.
Okay.
What do I do?
Okay, so if you were told that you have borderline lupus, That can mean a few things. Most likely it means that you either have symptoms, like you might have some skin symptoms, some arthritis, some pains, a lot of things going on with multiple organ systems, systemic things, but your test may be negative and your doctor may still have a very high clinical suspicion. So it may be a situation where the doctor says, you're not testing positive for lupus, but you seem like you have it. And so they may mean that they're going to just keep you in focus. They'll keep repeating the test and watching. Or it could mean that you have a positive ANA, but when your doctor did those specific tests, like the anti-SNP, anti-double-stranded DNA, yours may have been negative. So when they say borderline, more likely than not, your doctor means, okay, all your tests aren't lining up by the book, but I'm still suspicious that you could have lupus. And so they may still be just keeping you on the radar. So the only thing that you can do is to keep following up with your primary care physician. And if your doctor really feels like you're borderline, then they should consider a rheumatology consult if you haven't had one already. So I'll definitely bring that up. And remember that this is an informational lunchtime live. It does not replace visits to your doctor. So everyone should be in consultation with their physicians.
Those of you coming in, welcome. Don't be shy to ask Dr. Frida your questions. She'd love to answer them live for you.
I would.
I have lupus nephritis. Is it possible for my future child to also get lupus because of me?
That is a very good question. And I'm sorry that you're having to deal with the lupus nephritis. First off, you should definitely be seeing a kidney doctor, a nephrologist, as well as a rheumatologist, the lupus specialist, in addition to seeing your primary care doctor. And is it possible for your child to have lupus or lupus nephritis? The answer is yes. If someone in the family has lupus, then that does mean that there's a higher chance that your other family members will have it, like a child, but it does not necessarily mean that your child would have it. And when you phrase, will my kid have lupus because of me? When you say it like that, it kind of makes it feel like, it's your fault. It's not your fault. Unfortunately, lupus is not one of those things where a specific action that you did or something you did wrong caused you to have this disease. No, it's just the way the cards were dealt. So go on, have your children if you want to have children, and just make sure that you have your child to follow up with a pediatrician and to be very aware of what symptoms of lupus are. Make sure that your child's pediatrician understands that you have lupus nephritis, and just take care of yourself and your child. And I wish you the best.
What is discoid lupus?
Discoid lupus, that's a good question. So that's one of the types of lupus that will cause skin manifestations. In discoid lupus, you get a thick, scaly rash. It can be red, it can be purple. And usually when you go out into the sun, that will make that rash worse. So that's the discoid lupus. There are other types of rashes that can be caused with lupus. One that is common is the malar rash or the butterfly rash. And they call it that because it's on the nasolabial folds, meaning right in the area over the nose and over the cheeks, you can get a rash. And it looks almost like it's butterfly shaped, and it's worse when you're in the sun. So the discoid rash is more demarcated, scaly, distinct borders, whereas the malar rash is that butterfly rash specifically on the face.
Speaking of, rashes in the sun, do people typically notice more symptoms, so to speak, as far as skin rashes during the summertime?
Yes. Most people with cutaneous or skin conditions from lupus are photosensitive, meaning the sunlight and the high UV exposure will make the rashes worse. So when they go out and they're tanning and they're enjoying the sun, if you have lupus, the chances are great that you will have more skin symptoms with sun exposure. So you want to protect yourself from the sun.
Thank you. From Patty.
Hi, Patty.
I was diagnosed with lupus. I started getting blood clots. Is it blood clots also tied or a cause for getting lupus?
That is such a good question, Miss Patty. It's a very good question. So yes, many people with lupus are predisposed to getting blood clots, specifically if they have positive antiphospholipid antibodies. So yes, there's a direct relationship with lupus and blood clots. Also, if you have these antiphospholipid antibodies or even anticardiolipin antibodies, in addition to blood clots, if you're of childbearing age, the lupus can predispose some patients to having difficulty with fertility. And so it's definitely something that you want to talk about with your doctor. But the answer to the question is yes, as far as the blood clots. And remember, what lupus is it's the immune system, instead of just fighting the rest of the world, bacteria, germs, viruses, that immune system has turned and has attacked you. Autoimmune.
All right, thank you. Are there any kind of medications that's prescribed to either, I guess, treat lupus, or I guess you can't necessarily prevent it, it's autoimmune?
Right. So there are definitely medications that can help to treat lupus. And because lupus is a disorder of the immune system, the medications that help to treat lupus are medications that suppress or push down the immune system, such as steroids. So prednisone or Solumedrol is a start, but then there are other immunosuppressants which have less side effects than those do, like Plaquenil is one. So you definitely want to talk to your rheumatologist about which one is best for you. The trick about taking these medications that suppress the immune system, so they'll suppress the antibodies that lupus produces, the antibodies that attack you, but they'll also suppress the antibodies that fight germs and bacteria. So sometimes when you're taking these medications to treat the lupus, the side effect is that you might become more sickly. So it's important to ask your doctor about which medications will allow you to fight the lupus, but not suppress your immune system to the point where you're getting sickly. So you want to consult your rheumatologist about that.
Thank you. I want to say hi to Rajan for joining us today.
Hi, Rajan.
Thank you.
Thank you.
Hello to Darnice.
I'm Darnice. Thank you for joining the Lunchtime Live.
Rajan asks, is SLE have a lifelong, is that medication lifetime, a long time term for medication?
Okay, so the short answer would be yes, because it sounds like what you're asking as far as lifetime medication is systemic lupus erythematosus. Is it a chronic disease, or is it something that waxes and wanes? So as far as the disease symptoms, the symptoms can wax and wane, meaning you can sometimes have all kinds of arthritis, you can have skin problems, you can have joint problems, you can have pericarditis or inflammation around the heart, you can have pneumonitis or inflammation around the lungs. So you can have symptoms like that, even fever, fatigue, or you can go through periods where you have no symptoms. So while the symptoms can come and go, the disease does not. Once you are diagnosed with SLE, it is a chronic illness. And so you're never, unfortunately, completely clear of the title, the diagnosis, even if through good treatment and lifestyle, you can have periods where you don't have the symptoms. That being said, if you are having periods where you don't have the symptoms, your rheumatologist may decide that you can reduce some of the medicines, the immunosuppressants, but you always have to be paying attention and in close consultation, because again, once you have that diagnosis, the diagnosis does not leave even if the symptoms have been treated and your lifestyle is almost as if you don't have it. So it's a chronic illness.
Thank you for the question, Rajan.
That was a great question.
Darnice is piggyback off of Rajan's statement. Okay. She says, why is Plaquenil no longer working for me? For my lupus, my rheumatologist has placed me on a methotrexate injections, which is really hard on me.
Oh gosh, I'm sorry. That's another thing. So Plaquenil is one of those immunosuppressants which can fight the lupus, but for most patients, it doesn't have all the other side effects of prednisone. And so it's one that's more targeted with the symptoms without making you so sickly. In most patients, many patients do very well, but with that waxing and waning lupus, it's hard to predict. Sometimes a medication will be doing great for you, and then sometimes your body can become resistant to it. Methotrexate is also excellent for treating it, but yes, it can have a whole lot of side effects and be hard on the body. It's really one of those risks and benefits kind of a balance, because even though the methotrexate can be hard on the body, that doggone lupus can be even harder. So I'm sorry that you're having these symptoms, but the short answer to the question is it's just difficult to predict which medicines will work long-term. Lupus is a tricky illness. It waxes and wanes, and sometimes your body's immune system can figure out how to be resistant to a medicine that was working for you before. Depending on just how bad your symptoms are, you will want to talk to your rheumatologist and say, okay, tell me what else is out there for me. And your rheumatologist is following your serologies or those blood tests, and they can let you know if it's a safe idea to switch your medications, because there are other medications, and it's just really going to be a dialogue that you have to have. But I wish you the best with that.
Is there a time frame they may run the ANA screen or do your screenings, or how often they may do them?
No set time limit. So for the ANA screening, that screening test for the lupus, it just depends. Like for me, as you mentioned, when patients first come in with kidney disease and I'm screening for lupus nephritis, I'll do it initially. And I also do other screening tests for kidney disease. And if I find another reason why that patient has kidney disease, excuse me, then I may not ever repeat the ANA unless a patient is giving me some of the common symptoms of lupus. So there's no set time frame. It's just a matter of the physician's clinical suspicion. And speaking of those symptoms of lupus, in order to make lupus is a tricky thing because it is one of those illnesses that can be very nonspecific. There's, you can have fatigue, you can have fever, and that can be how your lupus presents. You can have, a little joint pain, and that's how your lupus presents. But when you consult your physician, there's a very specific way that we diagnose it. There are 11 categories, and if you have at least 4 positive categories, then you have the official diagnosis of lupus. So just to run over a few of them, the skin category. If you have that malar rash or that discoid rash, and then you're positive for one of them. And then serosa, which is a fluid, for example, that's between your lung and your chest wall. If you get some inflammation there or serositis, that could be one of the 4 out of the 11 signs. Also, arthritis counts toward it. If you have neurological symptoms like the brain, you can get a lupus cerebritis or an inflammation of the brain. Or if you get seizures, that counts as one of them. So there are 11 different categories. And if you have over 4 or more that are positive, then you have the lupus.
Inez, thank you for joining us. Welcome.
Hello, Dr. Inez.
A couple of questions. Did you mention the average age of onset of lupus, or is there an average age of onset?
Absolutely, there's an average age. That's a very good question. So most people who develop lupus develop it between the ages of 15 and 44. And women, again, are more likely than men to have lupus. There's a 9-to-1 ratio. Women are 9 times as likely to have lupus than men between those ages of 15 and 44. But if it's someone who's less than 15 or someone who's older than 44, then women are only 2 to 3 times more likely to have it. And we believe that estrogen plays a role of this, which is why it's so much more common during those reproductive or adolescent ages. So yes, the age of onset, 15 to 44, mostly women.
Thank you for your questions, Inez.
Thank you.
And you mentioned before, I know you say women of color. Is it more targeted, I guess, African Americans? Is that rate higher than Hispanics, or just in general?
It's more women of color, specifically African Americans. African American women, 1 in 250 will develop lupus. And then if you compare that directly to Caucasians, it's 1 in 400 people. And then falling right under African Americans, you have Hispanics. But definitely women of color. It can be Asian women, Hispanic women, and definitely African American women.
All right, thank you, Inez. Question from Mary Jane. How does one prevent it from happening? Is it possible?
It's tricky. Now, again, even though I'm talking about lupus and we do think there's a genetic or hereditary component, we think there's an environmental component, we think there's a hormonal component, we don't know the absolute cause of lupus. And so can one prevent it? We don't know. We think that, healthy eating, good lifestyle can certainly help you to do better if you have a diagnosis of lupus. But so many of my patients who have healthy eating, good lifestyles have lupus. So can you prevent it? There's no definitive way that you can, that we're aware of.
All right. Thank you, Mary Jane.
But the key is to, if you do have it, just pay attention to your body. If you're having hair loss, if you're having joint pain, if you're having skin rashes, seek help from your physician early on, because an early diagnosis can help to keep you from getting some of the more detrimental long-term symptoms and signs of lupus.
Okay. I was just about to ask about it suppressing some of those symptoms in the long, would it help you in the long run?
Mhm.
So,
Yes, it will.
From Brienne,
Hi, Brienne.
my husband had just been diagnosed with lupus.
Wow.
What are the chances of him not having a baby? Can this affect the sperm count?
Oh gosh. Okay. So if your husband has lupus, and I'm very sorry about that diagnosis with your husband, can it affect the sperm count? Here is a trick about lupus. Systemic. It can affect any organ system. So if your husband happens to produce antibodies that attack his sperm cells or attack some of the cells which help to produce lubrication for the sperm, then it could potentially affect the fertility. The key is for him to see the rheumatologist, and if you're having trouble conceiving, also see a fertility specialist. Lupus can affect any organ whatsoever, so it is possible.
Thank you. From Alma, what is
From Miss Alma.
tumid lupus?
Tumid lupus. So tumid lupus is a specific kind of lupus. It's a cutaneous or a skin-related lupus. And patients who have tumid lupus are very photosensitive, meaning if they go out into that sun, it can make their skin manifestations worse. What are their skin manifestations? A reddening or an erythema of the skin, also edematous skin or swelling. And in tumid lupus, sometimes you can have eye issues, ophthalmologic. You can have eye issues, and so you need to see your eye doctor. Here's the biggest trick about the tumid lupus. You can have all of these symptoms, get a lupus test, and your lupus test may be negative. So your primary care physician or your rheumatologist has to have really a high index of suspicion, so that even if your tests for lupus are negative, if you're still having all of these skin sensitivity to the sun symptoms, then you still may have this diagnosis. So it's one of the trickier ones, the types of lupus to diagnose.
Is pain related to lupus? Like someone's, I know like arthritis and all that, but are they have chronic pain as well?
Yes. Patients with lupus, especially if they have arthritis, can have chronic pain. And you can get the arthritis in any joint, but the wrist, the fingers, the knees are some of the more common joints where you have it. And literally, your body, those antibodies are attacking your joints, causing you to have inflammation and sometimes really debilitating pain. In addition to that, some of the rashes can be painful. And then, of course, if your other organ systems are involved, you can have pain. A lot of times, lupus and fibromyalgia can be confused, because the fibromyalgia is another one of those illnesses that can really affect different parts of your body, different points. So absolutely, people with lupus can have chronic pain. And a lot of my patients get so frustrated because they don't want to take narcotics and they don't want to be part of this opioid crisis, yet they have a great difficulty in controlling their pain. So that is one of the tough things about lupus.
You actually just hit on Darlise. She actually came back and asked, is it coming to develop other underlying autoimmune issues such as fibromyalgia or Sjogren's? Yes.
These are such good questions you're asking. So the thing about these autoimmune diseases, they don't just sit in one little box or in one vacuum. You can have more than one autoimmune disease or symptoms like more than one autoimmune disease at once. So the Sjogren's disease that she's mentioning, you can get a really dry mouth, dry eyes, and you can have problems as far as with your digestive system, things not going down quite right. And with lupus, you can have antibodies that can cause you to have dry mouth, cause you to have dry eyes, and you can present like someone with Sjogren's. And you can even test positive for some of the same antibody tests that test positive in a person with Sjogren's. And what was the other thing she said?
The fibromyalgia, which you kind of touched on.
Yeah. So a lot of times people, if you have the disease of lupus, then you may hit all of the categories of a person with fibromyalgia, but lupus would be your overriding diagnosis. A lot of times people are diagnosed with fibromyalgia while their tests for lupus are negative, but then in the future, the lupus test may come up positive, and then it's like, okay, what you actually have is lupus, not just fibromyalgia, but they definitely have a lot of overlapping symptoms.
So it is possible for doctors, I guess, so to speak, to the lupus diagnosis years before you actually have a diagnosis.
Yes, yes. You can have a false negative, like all your tests can come back negative for lupus, but you have all these symptoms. But when your doctor keeps repeating those tests periodically, maybe every 6 months, maybe every year, depending on how frequent your symptoms are occurring, they may find it like, you do have lupus.
So it's
The test
basically up
was
to
negative.
your body to say, hey, let's show this on this test this time around.
Yes, yes. And it's important for a physician not to practice medicine in a vacuum. Like, because medicine is definitely not just black and white, yes or no. If your physician is suspicious, then they have to keep searching, or even sometimes giving you a treatment for lupus, even if the test is not positive, if everything else is lining up.
Just being proactive about it.
Absolutely.
Okay, Inez has a follow-up.
Hi, Dr. Inez.
Does lupus increase the risk of cancer?
That's a good question. That's a very good question. Lupus in and of itself has not been shown to increase the risk of cancer.
Okay, thank you. All right, Dr. Fisher, looks like that's all the questions.
But for that question, now there are some medications that can potentially increase a risk of cancer, or a person's body can react, but lupus in and of itself does not increase the risk of cancer. And another thing, as far as a cancer relation to lupus, some of the treatments for lupus are chemotherapies. So you may have a patient who has lupus and they say, hey, I'm on chemo. And you think, oh my gosh, you have lupus, now you're on chemo, you must have cancer. No, a lot of chemotherapies treat lupus, which that might be where that question is coming from. Why are so many lupus patients on chemotherapy? Mm-hmm. Chemotherapy is one of the treatments for lupus, even in a patient who does not have cancer.
Well, take two. Thank you all for your questions.
Okay.
These are all the questions that have in for today, Dr. Frida.
Oh, it's over?
Yes, ma'am.
Oh, shoot. Lunchtime Live went quickly. Thank you for all of your participation. Thank you for joining. If you have not done so already, please subscribe to my YouTube channel, Dr. Frida, and please hit that notification button. That way you'll know when I'm doing these YouTube lives, and and also Instagram. Remember to follow me on Instagram at Dr. Frida. All right. Thank you all for joining us. Make sure you prioritize yourself, live your healthiest, happiest life, and I'll see you at the next YouTube Live.
Bye.
Bye-bye. Yeah, those are some good questions.